Continuing our discussion with the major minerals, we're first going to talk about phosphorus, which is the second most abundant mineral in the body. So remember that calcium is the most abundant mineral. Phosphorus plays some important roles in the body. It helps to maintain acid-base balance. It's part of genetic material and DNA within cells in the body. It assists in energy metabolism, so from things like our energy-yielding macronutrients, including carbohydrates, fat, and protein. It's a component of many cell membranes, and it's also found in some proteins. The recommendations are set at 700 milligrams per day, but there is a UL of 4,000 milligrams per day. And phosphorus is going to be found in things like animal proteins and milk products. It's also found in things like sodas and soft drinks, so those are very high in phosphorus content. And deficiencies are really unlikely. So they're not unheard of, but they're fairly rare or fairly uncommon. Our next mineral is magnesium. So over half of the magnesium in the body is found in the bones. The other half is going to be found between muscles, heart, liver, and other soft tissues within the body. Like phosphorus, magnesium also has some important roles in the body, so it's involved with the functioning of many enzymes and cellular functions. Like phosphorus, it's also involved in the use of energy or the release of energy from those energy-yielding nutrients. It's involved with the metabolism of potassium and calcium, so two other minerals, and then vitamin D, which we talked about last week. And it's also important for normal heart function. Magnesium deficiency is also somewhat rare and uncommon, but it can be caused by vomiting, diarrhea, so some excessive fluid losses can play a role in promoting magnesium deficiency. Alcoholism can cause deficiency. General malnutrition, so just not taking in enough food altogether. Because magnesium is found in so many foods, if you weren't consuming enough overall, then you may have a magnesium deficiency. And some medications can also cause a deficiency because they cause magnesium to be lost or excreted more readily by the body. Toxicity is also pretty rare, but can occur with overuse of laxatives that contain magnesium, so you want to limit or even avoid those. DRI is 400 milligrams for men and 310 milligrams for women. So women need slightly less magnesium per day. Magnesium is found in a wide variety of foods, including most slightly processed or unprocessed foods. So think about fruits and vegetables. Most grains will have magnesium as well. All right, sodium. So sodium is probably the mineral that people are most familiar with just because we hear about sodium and salt all the time. So sodium is a major part, plays a major role in the electrolyte and fluid balance of the body. So we briefly touched on this in some of the earlier videos. Sodium is the chief ion that's used to maintain the volume of extracellular fluids. So remember that water always follows the salt. So water is going to follow wherever the sodium goes. In addition to the electrolyte balance, it's also really important for acid-base balance, and it's essential for muscle contraction and nerve transmission. So sodium is really important. It gets a bad rap because of the blood pressure relationship, which we'll talk about on the next slide, but it really is very important. So having too little can be just as negative as having too much. As far as recommendations go, adults between the ages of 19 and 50 need 1,500 milligrams a day. This is the DRI. Over the age of 51, so up until age 70, the recommendation drops to 1,300 milligrams, and over the age of 71, the recommendation further drops, or the need further drops, to 1,200 milligrams per day. The UL is 2,300 milligrams per day, which is about a teaspoon, so really not that much, and when you think about everywhere that sodium is found, it's not hard to go over this. The dietary guidelines for Americans recommend that everyone should reduce their sodium intake to less than 2,300 milligrams a day, which again is our UL, and they call for certain segments of the population to further reduce their intake to 1,500 milligrams a day. This is because these individuals are at risk or at higher risk for developing hypertension or high blood pressure. So people over the age of 51, African Americans, and anyone that already has hypertension, diabetes, chronic kidney disease should decrease their sodium intake. Deficiency, like I talked about, is still a problem. So you don't want to cut all of the sodium out of your diet because you see remember the DRI is set for an amount that we need for functioning in the body, but it's just when we get to too much is when we have a problem. So a deficiency of sodium usually is caused by excessive sodium losses. So if you are running a marathon and you didn't drink any water and you lost a lot of sweat, if you've been very sick and have been vomiting or have a lot of diarrhea, anything that you're losing a lot of fluids, this is going to cause too little sodium in the blood, which is known as hyponatremia. So this is really a deficiency of sodium and can have some negative consequences as well. So too much sodium is negative, but so is too little. So remember that. Alright, so sodium and blood pressure. This is what we all hear about all the time. So there is a direct relationship between salt intake and blood pressure, but it's really unclear if salt intake actually causes high blood pressure. So there's definitely some relationship there, but there's other factors that are playing a role as well. Individuals that have diabetes, that already have hypertension, kidney disease, African American descent, a family history of high blood pressure, hypertension, and greater than 51 years of age, we see this relationship more often in those individuals. And then this high blood pressure we're concerned about because it's related to heart disease and stroke. So we want to keep blood pressure what we call normotensive or normal to help prevent that risk of heart disease and stroke. How does diet play a role? There's a thing called the Dietary Approaches to Stop Hypertension, or the DASH diet. So the DASH diet really focuses on increasing fruit and vegetable intake, which are very high sources of potassium, which we'll talk about next. An adequate intake of nuts, fish, whole grains, and low-fat dairy products, also pretty good sources of potassium, and then small amounts of red meat, butter, and other high-fat foods and sweets. So remember, red meat and butter are going to be higher in saturated fat, which is our bad fat, that's going to promote high LDL and decrease our HDL, or our good cholesterol. So the DASH diet is one way we can help to manage blood pressure. Additionally, just watching how much salt that we consume every day in our regular food. So watch the salt shaker. So watch how much salt you're adding to your food. Even once you eliminate, okay, so you tell me you never use salt, you never use the salt shaker at the table. Great. But there is so much salt in all of our other products that we're consuming. So processed foods have a lot of salt added to them because salt plays a major role in food preservation. So pretty much everything has sodium in it. So even if you don't use salt at the table, that doesn't mean that you're not over-consuming or going beyond that UL. So focus on whole foods. So basically anything that doesn't have a food label may have some still naturally occurring sodium, but it's not going to be in excessive amounts. And so always check the food label. Alright, so as I talked about, potassium is sort of our, it can help blunt the effect of sodium. So sodium and potassium are really related because of this fluid and electrolyte balance role they play. Potassium also plays a role in cell integrity and helps to maintain heart rate as well. So potassium is very, very, very important. It's sort of it's always cleaning up sodium's messes, I guess you could say. When we talk about blood pressure. So deficiency of potassium is usually due to dehydration. So the same thing with sodium. Anytime that we have a lot of fluid loss or electrolyte imbalance, this could lead to a deficiency of potassium. And because potassium plays a role in maintaining or regulating heart rate or heart function, this can lead to heart failure. Toxicity is pretty rare from potassium. From food sources, you're never going to get a toxicity, but it can occur, like we talked about last week with some of those other vitamins. Toxicity can occur from overuse or overdose of supplements. Because of this, the DRI is set at 4,700 milligrams a day. This is basically double of what sodium is. So again, because potassium can blunt that blood pressure effect, it's really important to increase our intake. And it's found primarily in fruits and vegetables, but potassium is also found in milk and other milk products. So thinking about the DASH diet really focuses on reducing sodium, but also increasing potassium because of this beneficial effect on sodium, and we have a beneficial effect on decreasing blood pressure. So, I really think the problem is that we're not consuming too much sodium, because over the years our sodium intake really hasn't increased. It's really maintained fairly level, but the problem is we're not consuming enough potassium. So focus on increasing your fruit and vegetable intake, and that may help prevent high blood pressure in the future. Alright, so wrapping up with our major minerals, chloride is a major negative ion in the body. So sodium is our positive and chloride is the negative. So we always hear about sodium chloride, which is salt. So sodium and chloride also always kind of travel together. Also plays a role in maintaining fluid balance. It's a part of the hydrochloric acid, which remember is that acid in our stomach. And like I said, it's found in salt. So no known diet lacks chloride because we're all consuming salt and sodium, and those two always go together. So no deficiency of chloride that you have to worry about. Sulfate is the oxidized form of sulfur, and it's required for the synthesis of sulfur-containing body compounds. It also helps proteins to get into their functional shape, to perform whatever functions they have based on that shape. And there are no recommended intakes for sulfate either, because deficiencies are pretty much unknown, and because sulfate is found in so many food items.